Hello friends, welcome back to Learning Nails and Aesthetics. We are in the Milady Aesthetics book. Check out my other videos, the Milady Nail book as well as the Milady Foundations book. We are in Chapter 5, Skin Analysis. We'll be reading from page 171 to 176. Keep in mind I am not AI. So mistakes will be made. Just laugh along with me. We'll figure it out together. Let's get to it. Identify treatment options for the neck and décolleté. The skin on the neck and décolleté pertaining to the lower neck and chest is not the same as the skin on the face. The neck and décolleté have fewer sebaceous glands than the face, so they tend to show aging more quickly. The neck and décolleté are more susceptible to irritation, photo damage, broken capillaries, fine lines, and wrinkles, which are called rhytides. Develop just as much on the neck and chest as the face. Tech neck, a new phenomenon caused by the repeated movement of looking down at a cell phone or other electronic device, has created a demand for specialty topical treatments that include antioxidants, growth factor serums, and additional moisture. Be cautious when applying vitamin A or alpha hydroxy acid products that may cause excess irritation to the area. A product such as retinol may be fine for the face, but may be too aggressive for the neck. Remind your clients that the neck and décolleté need SPF protection as much as the face does. Check in. Why do the neck and décolleté show aging more quickly than the face does? What is tech neck? What kind of products should be used on the neck and décolleté? Illustrate examples of skin conditions. Many internal and external factors affect the condition of a person's skin. Skin conditions are more than our genetic makeup. These conditions are what the esthetician is mostly concerned about, and they are the focus of skin treatments. Some of the most common skin conditions estheticians see today are adult acne, extrinsic aging from sun exposure and the environment, problems related to hormonal fluctuation, dehydration, which is a lack of water, and pigmentation disorders are also significant concerns to clients. Other skin conditions include comedones, hyperkeratinization, and erythema, which is redness. We can improve some of these conditions through regularly scheduled skin treatments by using specialized products and by avoiding the factors that affect the conditions. On the client's chart, you will want to note other conditions that may not be listed in Table 5-3 and that you learn about here and in Chapter 4, Disorders and Diseases of the Skin. So Table 5-3, Skin Conditions and Descriptions. Acne, sebaceous breakouts from hormonal changes or other factors. Extrinsic keratosis, a rough area resulting from chronic sun exposure, sometimes with a layered scale or scab that sometimes falls off. Can be precancerous. Aging, characterized by skin laxity due to collagen and bone loss, thinner skin, dryness, photo damage, and fine lines or wrinkles, which are rhytides. That's weird. Okay. Asphyxiated. Smokers have asphyxiated skin from lack of oxygen, characterized by clogged pores and wrinkles, dull and lifeless looking, can be yellowish or gray in color. Comedones. Open comedones are blackheads and clogged pores caused by a buildup of debris, oil, and dead skin cells in the follicles. Closed comedones, also called whiteheads, are not open to the air or oxygen. They are trapped by dead skin cells and need to be exfoliated and extracted. Couperose skin, redness in the skin with no visible vascularity because the matting of blood vessels is still small and fine, often seen with telangiectasia. Cysts, fluid infection or other matter under the skin that is encapsulated into a palpable, firm mass of varying sizes, from a pea to a golf ball. Dehydrated, lack of water caused by the environment, medications, topical agents, aging, or dehydrating drinks such as caffeine and alcohol. Enlarged pores, larger follicles due to excess oil and debris trapped in the follicles, or expansion due to elasticity loss or trauma. Erythema, erythema, redness caused by inflammation. Growths, skin cells and underlying tissue that overproduce and create an area that could be raised or flat, but can be distinguished with palpation. They may be the same color as surrounding tissue or may be pigmented. They can be present at birth or develop later. Herpes simplex 1, a communicable virus that appears as a vesicule on the lip similar to a blister. Find more information in the chapter on disease and disorders of the skin. Hirsutism, excess body hair located in regions where hair is not normally present, such as facial hair for women. It is commonly caused by a hormonal imbalance. Polycystic ovarian syndrome, PCOS, is a possible cause. Signs and symptoms of PCOS include irregular or no menstrual period, heavy period, excess body and facial hair, acne, pelvic pain, difficulty getting pregnant, and patches of thick, darker, velvety skin. Hyperkeratinization, an excessive buildup of dead skin cells, keratinized cells. Hyperpigmentation, overproduction of melanin due to at least one of three factors. A. UV exposure from the sun, tanning beds, fluorescent lighting. This usually appears as diffused brown spots of various shades on the skin. B. Hormonally induced, also called melasma, referred to description in the table. C. Post-inflammatory hyperpigmentation, also called PIH, occurs from a surface injury to the skin. Acne lesions, insect bites, and ingrown hairs are common causes of PIH. They can appear deep red, almost purple, or dark brown in color. They can gradually fade. Hypertrichosis refers to any excess hair growth, whether it is caused from hormonal imbalance or heredity. Hypopigmentation, lack of melanin production due to four possible factors. A. UV-induced, intermingled with UV-induced hyperpigmentation, no treatment options, but lighting the hyperpigmentation will usually blend the hypopigmented areas so that they are less noticeable. B. Post-traumatic, lack of melanocyte production due to injury, burn, or other trauma, including a deep chemical peel. Melanocytes may begin producing again over time, but the length of time is undetermined. Vitiligo, an autoimmune disorder that stops melanocyte production, creating patches of pigmented skin. Topical prescription drugs can occasionally trigger rejuvenation of the melanocytes. D. Albinism, a hereditary disorder causing lack of pigment in the eyes, skin, and hair. Irritation, usually redness or inflammation from a variety of causes. Keratosis, plural keratoses pilaris, a buildup of cells, a rough texture. Melasma, a form of hyperpigmentation that is characterized by bilateral patches of brown pigmentation on the cheeks, jawline, forehead, and upper lip due to hormonal imbalances such as pregnancy, birth control pills, or hormone replacement therapy. Melasma gets worse with sun exposure. Milia, hardened, pearl-like collections of oil and dead skin cells trapped beneath the surface of the skin. Milia are not exposed to oxygen and have to be lanced to open and remove them. Milia are typically the size of a head of a pin. Note: check with your state board, as lancets are not approved for use in all states. One way to avoid milia, I've said this before in other videos, you can be prone to them more than other people are. I get them every once in a while. But when you're washing or applying any products, apply it in small circles, wash in small circles. It does make a big difference, I've noticed personally. Also, when you dry your face, pat dry. Do not rub. It helps to avoid not only the milia, but, stretching your skin. Sometimes, depending on the products you're using and how aggressive they are, and how aggressive you are washing your face, on a cellular, teeny, tiny level, that could be trauma to your skin. So, if you're drying by rubbing a dry towel, cloth across your face, you're causing more trauma. That is just my thought on that. Continuing. Papules, raised lesions, also called blemishes. Oh boy, here's one of those words. Poikiloderma of Civete. All right, definitely got to work on that one. A result of chronic sun exposure, specifically along the sides of the neck, which turn a reddish-brown color with a clear demarcation of untanned skin under the chin. I'm sure when we get to the glossary, there will be some help with pronunciation on that one. Poor elasticity. Skin elasticity from damage, sun, and aging. Pustules, an infection papule with fluid inside. An infected papule with fluid inside. Scar, a mark on the skin where a wound, burn, or sore has healed and left a fibrous band of connective tissue, sometimes hyperpigmented or hypopigmented. Sebaceous hyperplasia, benign lesions seen in oilier areas of the face, described as looking like donut holes, cannot be extracted. Seborrhea, also known as seborrheic dermatitis, excess oil production that causes redness, irritation, and flaking, occurs most commonly in the hair as dandruff. Sensitivities. Physical reactions such as erythema, edema, wheals, which is spelled W-H-E-A-L-S, itching, stinging, or discomfort from internal or external influence on the skin. Solar comedones, large, open comedones, usually around the eyes due to sun exposure. Striae or stretch marks, dermal scars due to rapid expansion of stretching of connective tissue, leaving deep red, pink, or purple linear marks on the skin that gradually fade to a light pink or silver over time. They often occur during growth phases in puberty, pregnancy, and weight gain. Sun damage, UV damage to the epidermis and dermis. Primary effects are wrinkles, collagen, and elastin breakdown. Pigmentation and cancer. Telangiectasia, visible broken or distended capillaries less than 0.5 millimeters due to intrinsic or extrinsic causes. Wrinkles, aging, rhytides, lines, and damage from internal or external cause. Check in. How are skin conditions different from skin types? List and define 15 common skin conditions. Explain the causes of skin conditions. Be aware of what can affect the skin. Let's start over. Being aware of what can affect the skin will help you determine why a client may be experiencing problems. Often, skin conditions are due to more than one influence. The esthetician must evaluate multiple causes, both external and internal, to correct or improve a skin condition. Figure 5.10. Each client is different, and the skin of various clients may respond differently to the exact same treatment. So, looking at figure 5-10, if you are just listening, it has a picture of a woman. One side of her face looks younger than the other. And intrinsic aging, the side of her face that looks significantly younger. The natural aging process, collagen production decreases, cell turnover slows down. Time, genetics, gravity. Then on the extrinsic aging, external or outside factors that speed up the whole aging process, which is sun exposure, smoking, drinking, stress, unhealthy diet, lack of sleep, and lack of exercise. Signs of aging: hair loss, gray hair, thinner skin, dry skin, wrinkles, hollowed sockets, sunken cheeks. When they say hollowed sockets, they're obviously talking about your eye sockets. You would think they would have said that because it just sounds odd. Moving on. External factors that affect the skin. Habits, diet, and stress all play a part in our health, which in turn is reflected in our skin's appearance. Skin conditions can be caused by allergies, reactions, medications, medical conditions, and other external or extrinsic factors. Those word parts are pretty easy. Extrinsic means external. Intrinsic means internal. Additionally, lack of exercise, lack of sleep, smoking, medications, and drugs will have negative effects both inside and out. Sun damage is the main external, and in parentheses they say extrinsic, cause of aging. These factors can also contribute to skin problems and can be detrimental to maintaining a healthy and attractive complexion. As you read through the following chart, you can understand why correct skin analysis and product and treatment recommendations are so important. External effects on the skin: UV exposure, which is sun damage, tanning beds, environmental exposure to pollutants, air quality, environment, climate, humidity, poor maintenance, inappropriate skin care, misuse of products or treatments, overexfoliation, harsh products, allergies and reactions to environmental factors or products, photosensitivity to the sun from medications or products. Glycolic acid is a good example for that. It makes your skin photosensitive. Very important to keep these things in mind, especially if you're using it on a client. You should advise them of that. Internal factors that affect the skin. Our body's internal or intrinsic health affects how we feel, as well as how our body and skin look and perform. Free radicals, which are unstable molecules in the body. Dehydration, which is lack of water. Vitamin deficiencies, improper nutrition, genetics, hormones, puberty, pregnancy, and menopause all affect our skin's well-being. Hormonal imbalances can lead to sensitivity, dehydration, hyperpigmentation, and Microcirculation, problems that affect capillaries. Internal effects on the skin. Genetics and ethnicity influenced conditions. Free radicals, dehydration, vitamin deficiencies, hormones, medical conditions such as chronic illness, cancer, systemic diseases like diabetes, impaired immune function, puberty, aging, glycation, alters protein structures and decreases biological activity, pregnancy, and menopause. Check in. List 4 intrinsic or internal factors that affect the skin. List 4 extrinsic or external factors that affect the skin. What is the main cause of premature extrinsic aging? And that will do it for today. In our next video, we will be reading from this chapter, 177, pages 177 to 188, and skin analysis in the Milady Aesthetics book. Check out my other videos. Comment, like, share, and subscribe. Thanks. I hope this was helpful to you. Bye.